So I'm going to hit record so we can get started. So good evening. Welcome to the DMS information session. This is one of the first times we've had it in the evening. But as I said, the reason we have it is in the evening this time is because our DMS students are in clinical. So they were not able to be in clinical all summer. So they were anxious to get back, and we didn't want to take them out of clinical for a meeting like this. But they are here and they're going to discuss some things. So let me call on Chelsea. If you could explain what is this sonographer doing and what are some details about things that you have to do in clinical that might relate to that picture.
Okay, sorry, I had to get closer. So the sonographer is scanning the patient's gallbladder. She has them in a decubed position, which is on their left side, so that she can see it in a different view. Yeah.
So how hard is it? Is the you push on the machine, find gallbladder. Is that how it works?
Not exactly.
Do you want to explain that a little bit?
I had a very difficult time with one today, actually.
So give that example.
Oh, today my patient was very difficult to penetrate. I was pushing pretty hard, and when the sonographer came in behind me, she actually pushed a lot harder, and I just could not see it. I couldn't clear it out, couldn't get it. You have to try all sorts of different windows, adjust a bunch of settings on your machine, give a lot of pressure, roll your patient, have them hold their breath, all sorts of tips and tricks.
So what does it mean when you say difficult to penetrate? They might not understand that terminology.
So the transducer puts out sound waves into the body. So sometimes if you have a patient that maybe like bigger in size or has a lot of like bowel gas, the sound can't travel as effectively in the tissue, so you're not getting as clear of an image back to you.
Good. Someone must not be on mute, so please be on mute when you're not talking. I hear music or TV or something, and it is distracting, so make sure you're on mute unless you're talking. Okay, so gallbladder is one of the main organs that we scan. So you might scan a lot of gallbladders, and maybe you're not going to see all those babies that everybody's looking for. There's a disconnect that all we do all day is play with babies. A, we're not playing, and B, we're taking images of the fetus is, I believe, what people are asking. They always are asking, you know, I only want to scan babies, but that's not our career. Our career is all body parts except the heart that we're going to talk about. All right, Lindsay, can you explain what you see in this middle picture?
So since there's not like an image up, I'm just assuming maybe she's scanning like midline, maybe looking at the pancreas or the aorta. When we do abdomens, those are two things that we do look at and take images of for the doctor. But here for an example, you kind of want to make sure when you're holding the transducer that you're not holding it up by the wire. You want to be touching the patient, because if you're holding it further away, you're not pushing as like hard as you should be, and you can slide the transducer a lot and you won't stay in one spot. And that's especially important if you're trying to get something and you want to get a good window like Chelsea was saying. So you want to make sure you're holding the transducer correctly.
So can sonographers work from home, Lindsay?
No.
So they are touching the patients, even the COVID patient and tuberculosis patient. So right now, COVID is the big disease, but to be quite honest, over the years, sonographers are scanning people with all different diseases. COVID is just the latest one. So you would have a glove on like you see there, and you would be touching the patient. So it's more involved than some people think. One person said, well, you just wave a wand. No, you're not waving a wand. You're actually touching the patient, pushing the transducer, as Chelsea said, to get that abdominal image. Okay. Ellie, do you want to tell what this other girl's doing here?
I can't really see. Looks like she's also on the abdomen.
Can you see the ultrasound image at all, or are you on a small laptop or something?
I can't see that.
Allie, can you see it?
I can see it. It's really small, but I can tell that it's the abdomen. I see that she's using color Doppler to maybe measure blood flow, maybe the portal.
So how does that work? Do you just say to the computer, measure the blood flow, put on the color, and it knows how to do that, or how does that work?
No, so you would put on the color, but then you have to be at the correct angle so that the color will register with the machine. So you're able to see it and it fills in the vessel.
And so that is something that you have to learn about Doppler in physics. Allie, can you talk about how you're studying for your physics? Is it just a little bit of stuff you have to know, or what?
No, it's a lot of stuff that we need to know. Personally, I've just been taking there's a number of different books that we have, and I've been taking the one book that I didn't study as much previously the past few semesters, and I've been taking that and been doing practice quizzes. Every week you have to dedicate time to really dive into one of the chapters because there are a lot, and there's a lot to learn.
Thank you. We're going to skip the next slide because I already have your names from when you came in, so we don't have to worry about you writing your names. But we're going to talk about the next slide here, if I can get back and stop going too quickly. So let's see one of the other students that's here. Swathi, what's happening in this picture over here? Can you see that?
Yeah, it looks like they're doing a procedure, most likely a biopsy, and it looks like it's near the thyroid.
So what does the sonographer and the sonography student have to do related to procedures?
Procedures, there's a lot to prepare before the patient even gets there. There's paperwork, materials, working with the radiologist who's doing the procedure to make sure everything is in order before you even get the patient. And then while you get the patient, you're kind of imaging whatever area they want to either biopsy and taking those images and then assisting the radiologist in doing the procedure.
So is that something that you do like once a year, or how often does a sonographer do that?
At my current clinical site, it's done at least 4 to 5 times a day, some sort of procedure, and everybody that works there rotates and has a full day or half a day of doing just procedures.
Okay, thank you. Karina, what can you tell us about taking care of the patients like in this picture?
Okay, your patients are sicker than you think. I'm gonna be honest, when I thought about the career, I completely forgot about the imaging department in the hospital, and I only thought about outpatient centers, and I thought, okay, but if it's an outpatient, by the time the patient gets to me, like it should be stable, you know? But that's not the case. People throw up, people are hooked on oxygen, so you have to know how to maneuver the oxygen tank. If they get sick on your watch, you can't call the cleaning lady. You are responsible for that patient while he or she is on your watch. So if they throw up, you clean it up. If the colostomy bag comes undone and it makes a mess everywhere, it's on you. You clean it up. So it's definitely a lot more involved than I thought before getting into. And you're gonna practice a lot in the lab, like pretend, which we did that in the first semester. but you know that your patient is not, when you're in the lab, they're not going to fall because they can stand, or you're going to practice with the oxygen tank. You know that they don't really need that. I think the reality hit when we did 4 days of observation in the first semester, and I went at the hospital for 4 days, and I think that's when it hit, because in 4 days you see a lot, and you see a lot of levels of, people being sick or immobile. You still have to get your pictures, on a healthy person. Like Chelsea was saying, you have to, if you can't get a picture in one angle, you have to have them roll, you have to have them hold their breath and whatever. If the patient is sick and they cannot perform all those things, you still have to go through your protocol. So you just scan around, and it's definitely not as easy as people think, when they walk in and they think that you're going to be done in 10 minutes. You have to work for pretty much every picture. Some patients are easier than others, but I feel like most of them, for most of the patients, it's not pretty straightforward. You have a guideline, like you have a protocol that you must follow, but it's very different from patient to patient. On some patient, they might have a bigger liver, you're going to take more pictures. And this is for you, like, you have to make those decisions on the spot there. You have the guidelines, but you also have to use your brain, so to speak, to take additional pictures if necessary, or if they have a disease, again, it's not going to be just the protocol pictures.
Thanks, Karina. Now you also see Karina already mentioned about our lovely bedpans and urinals and things that people forget about that you might have to help a patient on. And you see in this other picture, the sonographers are in the operating room. So there's a disconnect that people think you're going to be a sonographer in a little office. The job market in our area is in the hospital setting. So you might have to go to the operating room, the emergency room, the intensive care, the NICU. You're going to travel all over the hospital in addition to the patients coming to you. So it's a little different than what people think. You can see the sonographers are moving the system here into another area. Some of the time, a physician can be right in there with you. And again, you have to know what you're doing. Let's have Chelsea. What's the middle picture here? What is she doing?
The one right in the center?
Yep.
So she is doing a venous leg, probably, or arterial leg. She's imaging the veins in a leg.
And your class is just practicing that. So you've been doing this a year. This has got to be easy. Is that right, Chelsea?
I can assure you it is not. It takes me an hour just to do one. And I see sonographers do 2 legs in 15, 20 minutes. You think your hand's not moving, but it's moving a lot, and that might be a millimeter, but that's a lot when you're slipping right off of a very tiny vein. It can get pretty frustrating, that's for sure.
Thank you. Swati, can you see what she's doing in the next picture here?
She is about to do an endovaginal exam, so an internal ultrasound. It's usually requires a whole procedure with telling the patient what the procedure is going to be, what to expect, setting up the room completely differently, and then a completely different scanning field compared to just looking at the gallbladder or the liver.
So that's another thing you do, like what, once a week or something?
Nope, you do it every day.
Every day, every day. So, and again, you see in the far picture that you're taking care of a patient who's sick. So the patients are very sick. It's not as straightforward as you think. So now students, you're going to be able to tell some of the things that students have said they didn't realize being a sonographer is sad. They didn't realize it was sad and serious. So Lindsay, can you see this first picture over here under the word diagnostic? Can you tell what that's trying to show on your screen?
Yeah, so it's showing that they're scanning a fetus, and the fetus has no heart rate.
And so how does that work at the hospital? That never happens, right?
No, it does. It happens, and the thing is you can't tell the patient, so you still have to just take the images, and if the patient's asking you questions, you can't answer them. You just tell them that the doctor's going to read the report, and they will tell the patient the results. So it is very sad, some of the things that you can see, but these are things that you see daily. So
thank you. Allie, can you see what this is showing?
Yes, so that is a scan of the breast, and it's showing a type of cancer, an invasive ductal carcinoma, and it's you don't know for sure that it's a cancer, but you're suspicious because it's very irregular.
And so again, is the sonographer telling the patient?
No.
But does the sonographer know what it seems to appear to be?
Yes.
So who is getting the information from the sonographer?
So this would be sent to the radiologist, and then the radiologist would look at those the images, and they would send the report to the doctor, who would then inform the patient.
Right. Good. Thank you. Karina, can you see what's in the middle here on this one?
One second. Is that looks like an aortic aneurysm?
Right. So tell us about an aortic aneurysm. Why is that a serious diagnosis?
If it breaks, the patient can bleed to death in seconds if the aorta ruptures. I should say not breaks. If the aorta ruptures at the where it's dilated, it could die on your table, honestly, if it happens on your watch.
So hopefully not, but
No.
it can happen. Okay, and then we see this picture over here. I think Ellie is Ellie, are you still there? I don't see Ellie. So we'll go back to Chelsea. Chelsea, what's this happening in this person's liver?
So that is a mass in someone's liver. I would think like maybe liver metastasis.
So
Or
can you explain what that is?
so it's cancer.
And why is that sad and serious? Because it's metastasis, it's not only cancer, but what else can you tell us?
So that means that it spread from somewhere else. So it started in a different organ and it spread to the liver, which means it's an advanced cancer.
Right. So this is the type of thing that we see every day as a sonographer. So it's not all about babies. So this shows you how many graduates and how many are employed. If you have a question about the career, what it's like to be a sonographer, go ahead and put that in the chat while you look at this chart to see if anybody has any other questions about the chat, about the chart. But we have explained some things about the career. Does anybody have any questions about the career? Please put it in the chat if you have a question. We'll give you a minute. Whoops. All right. Let's see if anybody has a question. I don't see any questions about the career, But we do have our Director of Clinical Education, Sue Gugoff, is here. So she's been in the career a long time. What would you want to share about the career and the things we just talked about? Sue?
Well, I think I would like to share that this is a very rewarding career. You are able to affect the patient's medical treatment and care. Missing any type of pathology could negatively affect their care. This is a diagnostic exam that we're doing, and it's very important that when we are doing the sonograms, we're very careful and we're diligent in order to produce diagnostic images for the radiologist. As Julia said, I've been in ultrasound for longer than most of you have been alive. And it has changed dramatically from when I started. And I like the changes. I enjoy my job. I enjoy teaching, as I was with two of the students that are on Zoom today. I was with them today. It can be very frustrating because everybody thinks we may wave this magic wand over the patient or we punch numbers into a computer and it takes the images. It is a skill. It is a very specific skill set that a person has to have. They have to practice a lot. And, you know, with the effect that COVID had on the class that's in now, you know, these students were in clinical for 12 days, and then all of a sudden they're not in clinical for 5 months. And so they had a very difficult time coming back. And that was something that the clinical people didn't quite understand because, you know, they've been in ultrasound for a long time. This is a skill that you have to practice constantly in order to become efficient and effective in producing these diagnostic images.
Thanks, Sue. Do we have any questions?
There is one, continuing education, yes.
Do you want to explain that, Sue?
Yes. There are seminars. There's also journals that we read in order to earn continuing education credits. We have to have 20 each every 2 years. I am also an X-ray tech, and I have to have 30 every 2 years for that. So I obtain ultrasound continuing education in order to fulfill both requirements. So.
And that's good that the question, you said you're certified. So we're registered or certified. We are not licensed. A nurse is licensed, but we are not. We are registered, credentialed, or certified. Does anybody else have any questions about the career before we talk about the program? Any questions on the employment? You can see a lot of years we had everybody got a job. Now, that does not mean they were full-time jobs, as you see. They could be part-time or per diem. Per diem means they call you as needed. So those are the statistics of our program and the jobs that have been obtained. The other thing, I'm getting a lot of phone calls that people are Googling jobs and they're telling me that they think they're going to make $100,000. That is not happening. She's laughing because even after her bazillion years of experience, she would not be making $100,000 at the hospital. So you can see in our area, you start at about $49,000, about $24 an hour. When you read, you want to be careful when you Google and read different things that they're talking about the median wage. Well, the median wage may be $71,000, but that's after years of experience. Does anyone have any questions about the jobs, the salary, the job market? Put it in the chat, please. We'll see if you have any questions about jobs. Anything you can think of.
I just wanted to mention, I remember in the past, if you Google like highest paying sonography jobs or something, we were finding that neurosonography was like the top, and that's the one that people are saying is like $100,000.
And that's not accurate at all. Okay, so to the program requirements, any other questions about the career or the job market or job salary or any of that? Have students been able to find jobs in a geographic location? So most of our students do stay in our area in South Central Pennsylvania, but we do have students in Maine, in North Carolina, graduates, I should say, Maine, North Carolina, California. So they have found jobs in other states, but most really stay close by. The job listings actually for our graduates, they are found at the clinical sites where they rotate. So they rotate through UPMC, Wellspan, Geisinger, all the different facilities. And that is a lot of times where they get the jobs. They find out about the open job from their clinical staff that they're working with. You can also go on all the search engines, and they do have jobs listed in sonography. Most hospital websites will have jobs for sonographer also. But most of our graduates get the jobs at the places they've been in clinical. So they really don't search for as many job listings. Good questions. Anybody have another question about the job or the career? Just check. Okay. So we are in the process of changing the timeline for the selection for DMS. It is, as you see, pending approval. So this has not been approved yet. You're the first to hear about it. That you will have to have your English, your math, and your biology completed by the spring, not by the end of the summer, by the end of the spring, by May. Now, Jackie, are you still here? We were talking in class about the biology. Can you talk about what would be a recommendation for the students to take the 2 biologies or the 1 required biology?
There's been a lot of people saying that the anatomy would have been a lot better. I'm not sure what they teach in the Bio 111, but anatomy is the 2 semesters, so they're able to get into everything a lot more thoroughly. And there's a lot of anatomy involved, so it definitely helps.
So Jackie is in the new group that was just chosen. We were only able to choose 6 because of the COVID restrictions, and she is one of the 6 that has started. And her classmates were talking about the biology. Some of them feel like they didn't learn the anatomy that they could have. The other advantage of taking both biologies is it means if you don't get into DMS, you can get into maybe Rad Tech or another program that requires both biologies. The other advantage is if you want to continue to get a bachelor's degree, those biologies will transfer more efficiently to get that bachelor's degree. How many in attendance are going to have English, math, and their biologies done by May, and they're going to apply? Put your name in the chat if you're going to be ready to apply.
Can I ask a question about that?
Yep.
So like I'm in biology 121 now, and then in the spring I'm going to be in math 103 and then anatomy and physiology level 2. Am I still going to be able to apply?
Yep, you're going to be in the courses you need in the spring semester. So in other words, you have to have, as you see here, English, math, biology. You have to be in those courses so that when you apply in March, you know you will be finished in May. Now, of course, if you don't finish the course, then you cannot apply, you know, your application will be ineligible. But it looks like we have quite a few that are going to be ready to apply. So you also would be ready to apply. So the issue is students don't understand how competitive it is. I talked to 2 students this morning to Zoom earlier this afternoon. They both said a general advisor told them that they just took the courses and as long as they passed, they were in. Totally incorrect. Only the top get in. So this year we had 30 applicants. We only picked 6. So 24 people did not get in. Does anybody have a question about that? Because a lot of people are confused about that. So I already see more than 12 people applying. So if all of you apply, some of you know you will not get in. Any questions? What can you do to improve your chances? Let me just see, here's our point system. So we'll look at that in 1 minute. This shows you other classes you want to have that you would want to have done also. Your electives, the more you get done before you apply, the better, because the program is very intense. And to have any of these electives left is very, very difficult to continue. So this is the point system. Again, it is pending approval. So the best to improve your chances, you have to get A's. All 6 students that were accepted had an A, an A, and an A. I met with a student yesterday. She has a C, and a B. And I had to tell her, you better come up with plan B. You're probably not getting in. So I'm not trying to be negative, but I'm trying to give you a reality check, because students get very upset with me when they say, well, what do you mean I didn't get in? Because it wasn't that you didn't do a good job, it's that someone else did a better job, got more points. So it's based on your grades and on the USA test. So I think Ellie, did Ellie come back? Ellie, can you give us insights? What in the world is that USA test anyway?
It's a test that you can't really study for, and it just tests you on, can't remember if it was like memorizing or puzzles, and I guess like problem solving. And then it also tests your skill with like using both hands on a computer, which now is really relevant to what I'm doing. So I can see the value in that. But it's not something you can study for, and you don't, unless I guess you meet with Julia, you don't really know what you get on that. So it's stressful in the end there once you are trying to calculate your points.
So I have another question. Do you accept transfer students? Yes, a lot of the students are transfer students. They might have an associate. We've had people with associate's degrees, bachelor's degrees, master's degrees. We've had everybody. People who don't want to do what they used to do and they want to do something different. So it all depends if your course is transfer. Math, it seems to be the one issue for transfer students. They say, well, I took math, but maybe the math that they took was statistics. Well, we don't want statistics. We want college algebra. That's another issue with some advisors. They tell the students, well, call Julia. She probably will let you take another math. No, it has to be college algebra or higher, which would be calculus. Do you know if we will be able to accept the 12? We do not know as of yet. We're monitoring the situation as everybody is with COVID. We won't know till we get closer to the application and selected period. But even if we take 12, if something happens next year that shuts us down, there still will be an issue. It says, for some of us that applied who didn't get accepted. So if your points are low, if you've met with me and your points on this test are low, there's nothing else you can do. If you have straight A's here, so you A, and an A, and if your points are low, you're not going to get in. Just like for nursing, they have the T's test. If your points are low, you're not going to get in. For dental hygiene, they have the T's test. Radiology has the Hobbit test. If you don't score high enough, you're not going to get into the health career program. We take the USA exam after you apply. So the new students, the new plan, again, has not been approved yet, is that you're going to apply in March and take the USA exam in March and April. So you can only take it once your application has been approved and I give you permission to take it. You really can't further explain it. Ellie explained it. I don't know. Students who've taken it, do you want to say anything else? They want to know, can you further explain it? Anybody?
Not really. It's pretty much like you would take an IQ test. It's just a mixture of everything. Like common sense, you're gonna have questions like, they're gonna give you like a scenario, what happened, something happened at work, and how would you handle it? I think a little bit of statistics, like it was, I remember one of the questions, I still don't know the answer to it, but it's still in my head. It was something like, according to the DMV, red Hondas are more likely to get into an accident. If you drive a red Honda, are you more likely to get into an accident? It was questions like that. It's very hard to explain. Another example was they would give you something moving on the screen, and you would have to grab the mouse with the left hand and try to follow that point around, and then type with the right hand at the same time. You can't really prepare for that. The only thing you can do is go in there, rest it, and take your time because it's not timed. So I was there for a long time. And I don't know how well I did. The only thing is in your control right now is getting straight A's in the 3 classes that you need to apply. We also had to do an interview. So we had a little bit, I guess we were able to control that somewhat because it was graded. So, you could, I guess you could do, get some extra points in there. But as far as this USA exam, you really can't do nothing. Just go in, like I said, just go in, rest it and relax and just stay in there for as long as you need to.
Thanks, Karina. That's right. So Karina mentioned the interview, so that process is gone. So no one will be doing an interview, but her group, they did have to have an interview. Yes, you're going to apply in March. You're going to take the USA test in March and April, and you're going to find out by the end of May rather than August if that is approved. So that's the new plan, but it has not been approved by administration. The fee is $65 to take the exam, and the students had to go to the test center before, but the most current students did it online. Jackie, how did that work that you did it online?
So it went through a separate company that just proctors exams. So they, you kind of connect with them on video and then connect with the test separately, and they kind of just hang in the background while you're taking it.
Thank you. Would you add anything? Because you took it more recent than the rest of them.
No, it's tough to explain. Some like follow like a pattern, but yeah, similar like an IQ test, I would say.
We will know probably by the end of this semester. I'm hoping by the end of October, but I'm not sure, but it's supposed to go through committees to see if they're going to approve this change in the timeline. Other questions about the selection process? So you can see it is not a waiting list. So one student said, well, if I don't get in, I'll get in another year. You don't know that. It's not a waiting list. If your scores are not high enough, you're not going to get in. The students this year, the top 6 were 100 and above. So the student that had 95 points and below did not get in. And it went from 95 all the way to 45. So whoever had 45, I can basically tell them they should meet with an advisor and come up with another option. Other questions about the selection or application process? You got some really good questions. Thank you so much for those good questions. So here again is the range of how many were applying and how many were selected, and over the years, the different GPA. Here's how many graduated. So again, this is when they started, this is when they'll graduate. So I wanted to put the 12, but I didn't put it yet. Just we and how we want to be sure. And here we'll just have 6. You noted that this year there was only 7 in the 1 year, and these are the 7 graduates in that picture. So they started with 12 and only 7 graduated. 5 either failed or changed their mind. It was too serious and sad. Okay, it says, do you know when we'll be approved? We'll see when that happens. Do we get to meet with you after the USA? You meet with me after the selection process. So once everybody's done taking the USA and all the grades are posted and the letters are mailed, then you can meet with me and I can explain the results. So it doesn't, you don't hear about that until after. Like one of the students said, if they didn't meet with me, they didn't, most of the students who get in don't even care what their score was. They just know they got in. When you state another option, yes, you need another degree that you're going to seek if you can't get into this. In other words, again, a few months ago, 6 letters went and Jackie was one of them. 24 people didn't get in. What did they do? I don't know, but they have to think of something else. The closest career in the academic work is radiologic technology, the person who takes x-rays. So that program is the closest. The closest in the career is cardiac sonography, where you take ultrasounds of the heart. So you may want to look into some of these other careers, especially if you are not a high-level A student. It's going to really be a struggle if you aren't top, if we keep getting as many people interested. And I see already from just tonight, this is our first information session, and we already have more people than we can accept, even if we take 12. Other questions? So like we
What's the
said,
point range on that picture?
what's that?
On that picture you were showing, it said point range. What was that referring to?
That's the points on this points. When you go back here, whoops, let me move this away. This was 110. So that, you're right, there's a mistake. Let me see, is that, no, 110 is the total. So the students who got in had 100 to a 105. The year before it was only worth 90 points and the years before 84 points. So you can see it's interesting. Look at this range, but notice they didn't graduate because their GPA was lower and they really couldn't handle the workload. And these are the 7 that graduated that are all employed. Good questions. Any other questions? So you apply and then you take the USA test. The USA test has to be on a computer with a mouse. As they said, it's going to tell you to do that. So it can't be a tablet, iPhone, Chromebook, etc. when you go to do that. In addition, students are surprised that there's more money involved. They think, well, I have financial aid, it's going to pay for everything. Allie, can you address a little bit about out-of-pocket expenses you've had?
Sure. So definitely the ones listed. We aren't provided scrubs, so you have to buy your own scrubs, which they can be expensive depending on what kind you get. Especially because depending on what clinical site you go to, we have 3 different colors, I think, if I remember. So there's gray, black, or Caribbean blue. So one semester you could be someplace where you need black. The next semester you could be someplace where you need gray. So that means that you would then have to buy more scrubs. The background check you have to pay for, and all your clearances, and the background check, and that's something you have to do every year. So we had to pay for it last year, and then we had to pay for it again this year. And then depending on if you have a primary doctor or not, you do have to be up to date on all your vaccines. I know personally, when I got into the program, I didn't have a primary doctor, so I had to get a lot of vaccines. And luckily I have health insurance, but if you don't have health insurance, that could be really costly. I live in Dover, which is right near York, so gas, and I have a Jeep Cherokee, so it's not great on gas. So I fill up my Jeep about once a week, so that does get very expensive. So really have to keep in mind what vehicle you're gonna take if you live far away. Yeah, that's it, I guess.
Sue, can you reference the next question? Can we get our clearances before the course and have them count for the program?
No. We want the students to all get their clearances at the same time so that it's easier for us to track. Also because some of our clinical sites require the clearances in a very specific time period. So we tell the students, do not get it in advance because you're just going to have to do it again.
Right. So even if you have the clearance because you help with children or something, you're going to have to get it again. It has to be current. And as they said, it's every year you're going to pay for that. So here's another big challenge, that it's a full-time, daytime commitment. So Jackie, do you want to address that as a new student, and then we'll have one of the other students? What about the amount of time that you're studying and you're just starting?
It's definitely a lot of studying outside of class. The classes are long, they go for a long period of time. And then you want to put extra time in the day you get at the lab to scan. So it does come out to like a full-time job plus some.
Lindsay, how would you respond to the amount of preparation you've had to put in for the last year of your life here?
So lots of hard work. So we just went back to clinical. So we're going 4 days a week. And then on Fridays, we're in lab all day. And we're making up from what we had missed before, like when COVID had happened. So over all the time, we had to have classes moved up. So we got most of our classes almost done. We spent basically all day, 2 days a week, doing 4 classes. But then when you're not in class, you're spending all your time studying because you have to make sure that you're understanding to apply the knowledge, and you want to make sure that you're passing your exams. And like Julia said, now we're preparing for our first boards exam. So on top of us going to clinical 4 days a week and having lab all day Friday, we also have to have time to take care of ourselves, but also study for these exams because we also pay out of pocket for those as well. So it's a lot of studying and time commitment, but it'll be worth it.
So can you work a lot of hours? Can I work 32 hours a week, do you think, and do this program? What do you think?
No, definitely not. I had a job and I quit it in the first semester because you just want to make sure that you're focusing on the program, because if you work too much, you're not going to study and you're just going to not do well on your exams.
Right. Any questions? Because someone said that it wasn't really explained to them the amount of time that this program involves. Any questions? Put that in the chat. Does anybody have any questions about the time? It is very intense, so you have to make sure you have everything else taken care of. If you're not going to be able to work, you're going to have to be careful if you're going to need to take care of children. The classes, good question. The classes are Zoom, but we are in the lab. So as Jackie said, her class is in lab Monday and Thursday. And as Lindsay said, her class is in lab on Friday. But the other classes are in this format in Zoom. I'm going to be hoping that eventually you get back to the class, but as you know, they've said the college will remain like this at least till next year. So we'll be Zooming, we'll be in lab, and we'll be in clinical. So we're doing all three things. Other questions? So one student had said, show the part of the syllabus. Why is this syllabus give you an idea of the amount of time that you have to put in? What do you think? Allie, what do you think on that one?
So the syllabus shows that every week you're going over something different, and then you have the test on it the following week. So, and when you're going over it in class, it's so much information that it's really just kind of however long the class is. Let's say it's 3 hours. I forget how long our classes are. For the full 3 hours, you're learning new information, but you do also have to dive deeper and do things outside of class to learn that information, because there's no extra time in class for really reviewing information, if that makes sense.
Yep, that makes sense. Any of the other students want to add anything? All right, any questions about the testing and what you're doing every week? So it's interesting that I've had multiple people who say to me, you know, nursing, I tried nursing, that was too hard. I want to do this, it's so much easier. How would you respond to that, Chelsea?
That is absolutely not true. This program is probably the toughest thing I have ever committed to in my life. I have a bachelor's degree from Penn State. And in the 4 years getting that degree, I didn't put any of the time that I've already put in I guess a year of this program. So it's intense.
Thank you. The tests are done on computers. So they are on the computer. When we were on campus, these students were in Select Medical 111, which is a computer lab, or Blocker in a computer lab, and the weekly tests were on the computer. Now they're on Zoom and the students are on their honor to take the test. They are multiple choice, similar to the national exam. So the tests are on D2L in the multiple choice format. Any other questions about that? Testing or any of that? So this is a list of our hospitals that you will rotate through. Some of these. So Sue, our clinical coordinator, can you explain a little bit? Do I get to pick wherever I want to go? Like, you know, if I live in York, then I want to go to WellSpan York. Is that how it works?
No, we have basically the faculty for the program assign a clinical site, possibly 2 clinical sites that the student will rotate to for the semester. And then the next semester, frequently they will go to a different clinical site. We do that because it's very interesting. Ultrasound, everybody does a different protocol sometimes, minimally different. They all come out to the same thing in the end, but the way they get there is different. There's different equipment at different sites. So we like to have our students experience as much as possible. So we send them to different clinical sites throughout the program. Also, some of our clinical sites don't do all the ultrasound procedures. Some don't do any vascular, some don't do any OB, some, so the student has to rotate to the different sites in order to be able to get the experience with those types of procedures. So no, the student does not choose their clinical site.
So that's the other thing, you need your money for driving. So it might
Yes.
take you an hour, depending where you live, to get to one of these places. And you do have to be there 7:30, 8 o'clock. So you do have to wake up early. I've had students say to me they never had to wake up so early in their life till they got into the program. Any questions on these clinical sites and the clinical rotations?
I just want to say another thing is like when you're at clinical, you're alone. As a student, there's typically not another ultrasound student with you.
Good point. So that's why we have to have so many sites and we can only take so many students. Unlike nursing that can have 10 students at Harrisburg Hospital, or respiratory therapy has 6 students at Harrisburg Hospital, or rad tech has 4 students at Harrisburg Hospital, we have 1 student. So it does limit us, but ultrasound departments are small and they don't want a lot of students. 1 is plenty for them to take care of. Here's the list of everything you have to be competent in order to graduate. This is general sonography, so you have to know all of these things from head to toe. Any questions, please put in the chat if you have any questions. Lots of things to know about. And then, as we said, you're registered and credentialed. You have to take 3 national exams. The students, a little bit ago, they paid their $225, had to come out of their little hands to pay for the first test. And that will be taken when, Karina?
December 16 at 10 o'clock mine.
Yep, December 16th. So they have a lot to study for. The testing is at a separate test center that they have to prepare for. So to be a sonographer working in the career, you have to pass the program, you have to pass these 3 tests. We're excited that for the last 6 years, we've had 100% pass rate on all 3 exams. Every sonography program, if you look on their website, they have to post the statistics as to how many have passed these tests, so you can see that. Any questions are on these registry exam tests that you have to take to be a sonographer. So nurses take 1 big test, we have to take 3. Any questions? So what questions do you have about the career or the program? If you have a posed picture like this, it looks like, oh, we're just having fun, but that's not reality. All of these students graduated years ago and they are all working in different areas, some nearby and some further away. So it's like Sue said, it's an excellent, rewarding career, but it does take a lot of work and effort, as the students have told you. What other questions do you have about the application, the selection, the courses, anything else? This is your chance to ask anything you need and to ask the students, because they have nicely given up their time. They were in clinical all day, so I'm sure they're a little tired out. But do you have any questions? The 3 tests that you're going to take are from the ARDMS. Principles is really physics, but they changed the name because nobody likes the word physics, but that's what it is. Abdomen and OBGYN. In the abdomen is where you're going to have questions about thyroid and scrotum and all of that. No, you cannot come in for a tour. No, you cannot shadow. The college is closed except for the students that you see that have spoken in our program this evening that have been given special permission. We had to go through a lot of special permission to get them in the lab. So no one else is permitted in the lab. We're not permitted to have any visitors. We're not permitted to have any other volunteers. Typically in the past, people could bring their husbands, their parents. Now we can't bring anybody. It's just us, the students and the faculty. And no touring and no shadowing at the hospital. No longer a requirement. Other questions about anything? So the issue with videos, to tell you, first of all, the students are going to work on a video on Friday. So they'll talk to you about it. And we can do that. But really the issue is when you watch videos, a lot of times they always show the happy, positive part. And there are a lot of videos. If you Google sonography, there's a lot of different videos out there. But you have to be careful to know they are promoting, but they're not telling you any of the stress that's involved. Everybody's smiling. The patient is, oh, the patient walks right in, lays right down. It's not like what the students were telling you. The issue has been, which is interesting, we've had students shadow and then get in the program, get to the hospital, and then say, I'm not doing it. Because they said when they shadowed, it looked easy. And I think that's the problem with a video. You watch a video. I can watch a video of the Olympic ice skater, whoever is in the Olympics ice skating. And boy, it looks easy. She turns around, she jumps, she spins. Oh my gosh, it's easy. But I can tell you that when I went to learn how to ice skate, I was falling down all the time. So we make it look easy. The videos make it look easy. It's really just a challenging career. Now we do have on the website, we have the SDMS video, which you can watch. We have a PowerPoint, which you can watch. So there are things on the HAC website on the DMS homepage. So there are videos there from the SDMS, etc. But you want to take it and understand they're not going to show you the patient that vomited all over you, because that doesn't make a good video. Any other questions? Yeah, I'm going to try and have this session finished, and then I will see where the IT will probably put it again on the DMS webpage. Any other questions? Our advisor here, do you have any comments based on what you learned this evening?
I just sent a thank you to the students because some of the other information sessions I've been sitting in on, they don't have the students talk about what the experience is like for them. And what they shared today was very, very helpful. So thank you, students, for being willing to do that. I was going to jump in and promote nursing, but I chose not to.
No, you don't want to do that for a bunch of sonographers, because we hear about the great nurses.
I have to be less centric about nursing because I am actually advising other health career programs. But at this point, I don't have any questions because I thought you went very thoroughly over everything. You answered my one question. I was asking if students, I know there are students from Lancaster that will apply for the DMS program, and was just wondering, can they get jobs back in the Lancaster area? And it sounds like they can. So I'm not sure how many from Lancaster end up in the program, but I know I've talked with people before about it. So
yeah, there's usually a few from that area. And we do have graduates that do get jobs at Lancaster General, even though Lancaster General is affiliated with another program. But we actually have the recruiter who does come and let us know that there's jobs there. And so we do have graduates working there. And of course, at the Heart in Lidditz, at UPMC Lidditz, we have graduates there. So there are other areas near there. The issue is to remember, if they live in the Lancaster area, they're going to have to drive to campus in Harrisburg for the lab and for when we go back to class. So again, it is an hour drive for some people, and they forget that they're going to drive to campus. Whereas, you know, the cardiac sonography program, which is ultrasound of the heart, is at the Lancaster campus.
Along with the radiological program too. So it was helpful that you pointed out the relationship of those two programs to the DMS program. If this doesn't work out, you got options, and I think that's important to point out to students. So
right, especially because Rad Tech typically takes 30 students, so they have a bigger pool, because like we said, they can have a lot more students at every hospital. Students, DMS, did I forget anything? Is there anything on your heart that you want to tell these people, because you saw there's more than a dozen applying? Is there anything else you want to tell them?
Did you mention anything about our grading system?
No. Go ahead.
So I don't know if anybody was aware, but in the health career programs, you need a 77 or above to pass. Also in the DMS program, for nursing is different, but in the DMS program, if you fail a class, you are out of the program. So you cannot just retake that class and move on, or wait a year and then start again. So I think that's something that it's good to know, I guess, before you get yourself in it. Because like I said, you get 76 in one class and you're out of the program. And the worst part is that once you're in the program, and let's say you fail a class in the second semester, all these classes that you took in the first semester, you can't use them towards another program. So I think that if you decide to get into this program, you have to be very committed. Otherwise, you're going to waste a lot of money if you don't put the time in it, because like I said, you can't reuse most of those classes for other programs.
Right, and 77 is DMS, not every health career.
I wasn't aware. I thought
yeah, every health career is different. So, but for DMS, it's 77, because we know that if you can't pass our test with a 77, you're never going to pass those national exams. So we have a high bar. So it says, is that a 76 at the end of the semester, or if you hit a 76 at all? No, it's at the end of the semester. So if you fail 2 tests, but you get A's on all the other ones, you'll be fine. So that's where you have to make sure that you're consistent. Sue and I do meet with you if we see a lack of consistency. If we see, Sue met with students just the other day because we saw their grades were not up to par. So we will meet with you, but then we will give you study tips and things like that. But then it's up to you to really maintain a high academic level. This program is very high academic level. It is not for someone who doesn't have the time or the effort to put into the program. As Karina said, you really have to be dedicated. Otherwise, you're not going to be successful. Any other questions or comments? Sue, anything we forgot?
I can't think of anything at this point.
All right. Any other last minute questions?
I just want to say good luck to everybody. I feel like it was just yesterday that I was in your shoes, really anxiously hoping to get into this program. If it's what you want, go for it. Good luck.
As you can see, Chelsea is our cheerleader of the DMS students. So she is telling you good luck, but she's also telling you make sure this is what you want to do. Any other questions? I think we're good. Have a good evening. Thank you so much for attending. If you have any questions, don't hesitate. Email me is the best way to get an answer. So my email is jrimbode@hack.edu. Email me anything about DMS and I'll be happy to answer that. And if you need to connect with one of these students, they'll be happy to do that. So have a great evening and enjoy the fall weather. Take care. Have a good night.
Thank you.
Good night, everybody.
Night.
Yeah.